What's up, everybody? So welcome back to the series that is entitled Before, During, and After. During this series, I am giving my 2 cents advice on how to break into the medical coding field and what I feel like you should do, or what I would have done if I can go back before I became credentialed, during me studying to become a medical coder, and after I became credentialed. So if you haven't seen the first video of the before, I'm going to go ahead and put it in the card somewhere up here. I'll link it down below, but you should watch that video if you aren't already in school and you're trying to research what school you should go to or how to pick good schools. Just things that you should do before you become a medical coder, or before you settle on a school to become a medical coder. So this is part 2. This is the second video, and this is the during stage of medical coding, studying for your medical coding. So while you're in school. So if you are someone that is currently enrolled in a medical coding school and you wondering what can you do to increase your chances of obtaining a job once you become credentialed, then this video is for you. So I would suggest you keep watching. You are watching this video probably because you are in school and you want to make sure that you are doing as many things as you can to ensure that once you become credentialed, that you will be able to, obtain your first medical coding job once you get that notification that you passed your exam. I'm working, by the way, which is why I am looking away from the camera, but I got my notes right here too. So while you're in school, I have 5 suggestions that I would like to talk to you about. And we're going to get started with the first suggestion. The first thing first would be to start networking. So at least in my area, if you are not yet credentialed, we allow anyone that is thinking about getting into medical coding to attend like an AAPC chapter meeting 3 times without being credentialed. And so if you have that opportunity in your area, or anywhere on AAPC's website, or just look for a place where you can at least network with some coders, whether that's attend a chapter meeting, whether that is some coders and you just want to network with them. You can ask them questions about what's going on in the job market. If you know of a physician or a healthcare provider that you're real cool with and they have a relationship with their coder, maybe you can ask them if they can, kind of hook you up and, introduce you to a coder. Online, there are lots of medical coders that's on YouTube and, other social media platforms that is willing to give insight on the industry. Hit them up and ask them if you can ask them some questions just about the industry. But you need to network with different medical coders because you never know who has a job opportunity or know of job opportunities that will help you to get in. Besides medical coders, make sure that if you are already in the healthcare industry, like you working in a hospital, clinic, doctor's office, you working at like an insurance company, see if you can network with different managements or different types of providers or different departments, just to let them know that you are in school, you're studying for your medical coding credential, and you just want to make sure that you let as many people know that you are going for this credential, so that when you do get out of school or pass your exam, that you can be notified of any jobs that may be coming up in the coding department. So a good example I have of this is I used to work with a young lady that was working in the cafeteria in the hospital that I worked at. And she used to, kind of sit with and visit with me and another one of my coworkers at lunch and just talk to us about our jobs. The young lady that it was three or four of us. I was a coder. There was a couple of billers. There was, a person that worked in the prerequisite department or pre-authorizations. And she would talk to us, like when we come down for lunch, she would take her break and come and just ask us about our job. She was just saying that, she didn't want to work in the cafeteria forever. She was still fairly young and she just kind of wanted to get her foot in the door and she didn't know exactly where she wanted to go. She was thinking about pharmacology. She was thinking about medical billing. She was thinking about medical coding. And she just was kind of picking our brains as to what she wanted to do, when it came time to, make a decision about a career move. So she ended up settling on medical coding. And what she did was, she got to know some of the medical coders, got to know some of the billing managers. She, talked to a lot of the providers that came through the cafeteria. And like a lot of people knew her name. They knew of her. They knew her work ethic. They knew she was at work every day, how friendly she was, how personable she was. And they just got to know her. So when she passed her exam and it came time for her to interview, she was already in the healthcare system and she already had a rapport with some of the departments. So she, applied for a few jobs. She actually applied for some jobs in billing because she thought that she, probably couldn't get a job right away in coding. So her route was to become a biller, then to become a coder. But lo and behold, because she, had a relationship with a lot of the department heads, she ended up getting a job as a medical coder when she got done with her certification because she networked. So networking while you're in school is a great way to try to help ensure that you will get a job as a medical coder when you are done with your exam. Number two, you need to craft a great resume. So a lot of times, if you follow me on TikTok, and you should, I'm going to put my little TikTok right here. I'm at the Medical Coding Girl. But if you follow me on TikTok, I talk a lot about optimizing your resume and making sure your resume reflects the skills that you have that transfers into medical coding. The most popular question I get is, I only have customer service skills. How do I optimize that into medical coding? That's a great question. And it is very, very much is akin to customer service. You are servicing your patients, you're servicing your providers. So you need to make sure that the skills that you've acquired in your past jobs, you can transfer that so that the recruiter can kind of keep it in mind when you're talking about, medical coding. So for example, if you have like, say, customer service skills, say for instance, you worked in retail and you work with, communicating with your manager, communicating with your customers, you can basically play up your communication skills because communication skills is very important in medical coding. You're going to have to learn how to be comfortable educating your providers. You're going to have to be comfortable educating or working with billers. You're going to have to be comfortable working with pre-authorizations and other departments, medical records and that, so you need to have strong communication skills in order to be a medical coder, whether that's verbally or whether that's written. So you need to highlight that. You need to make sure that skill is optimized in your resume to show the recruiter that you do possess that skill. Another example, if you are a cashier, you probably worked with reconciliations. You probably worked with, understanding how to research different, products and services. I can only relate this to the experience that I have. When I was younger, I used to work at Goodwill. And Goodwill, you get donations in A lot of times you have a guideline on how to price these donations for resale, but a lot of customers like to haggle. So you will have to reconcile the prices for the customers in accordance to your store policies. So I could have optimized that skill if I didn't have other skills that possess that, but I could have optimized that skill on my resume to show that I knew how to reconcile charges based on what our company policy was for certain items uh, against what a customer may thought that this product was worth. Something like that. That's just a wild example I'm getting off the top of my head. Also, you will need to know how to research. You have to do research. Again, using my Goodwill example, you get a lot of antiques or a lot of valuable, stuff that come into the store. If your eye was untrained and you didn't know that this particular vase could be worth something, you will have to understand how to research the value of that particular product in order to price it fairly, that for the customer as well as for the mission of Goodwill. So I can have optimized a skill like that on my resume to show that I know how to do research, because in medical coding, you're going to be doing a lot of research, a lot of research. So, optimize your transferable skills that you may not think is related to medical coding because it wasn't in the healthcare field, but it still kind of is. It's in the same vein. You still use that same muscle. So craft a great resume. Make sure you highlight that you have training in CPT, training in ICD-10, training in HIPIC. You know how to look up payer policies. You know how to work with different insurances. You know how to sequence. Understand medical coding guidelines. The things that you learn in school that they tell you is relevant in medical coding, highlight that on your resume so that the recruiter will know that you are familiar with medical coding and not just somebody that just took the class, passed the test, and didn't retain the information. They need to know that you understand payer rules. They need to know that you understand coding guidelines. They need to know that you understand that. Number 3, research jobs. So while you're in school medical coding, I will research as many jobs as possible, make a list on some of the companies that I want to work with, make a list of some of the skills that these companies require that you possess, make a list of the credentials that these jobs are, asking for. Make a list of as many things as you can that stand out to you in these job postings so that you will know how to, craft your interview when you have your interview. You want to make sure that you understand the company's mission statement when you will go and apply for these jobs, their values, because that's important, especially in healthcare. That's important to them. The mission statement is part of their plan of development. So if they understand, or they will be very impressed if you understand their mission statement and your mission aligns with their mission, you would be an easier fit or better fit in their company if you have researched the jobs, research the company, know the culture of the job. So research the jobs before while you're in school, and take note of some jobs that you may be interested in. Those same jobs may not be available when you apply for a job, but you will have some kind of guideline on what you are looking for when you are done with school. Number 4, and I mentioned this in the networking piece of it, but attend meetings and review classes. So each chapter of AAPC, and I'm speaking for AAPC because that's what I have the most, the most experience with. They hold some type of review session. They hold meetings, monthly, every few months in a lot of cases. make sure you attend those meetings and those review classes if possible, because you will learn a lot in those classes. Not only will you get to know other coders and other billers in your area, maybe even other providers in your area, maybe even, the insurance companies, in your area, but you will also be able to kind of get some insight on any job openings that may be coming up. And when you talk to other coders or other billers that's attending the meetings, they may, know of jobs that's, being offered in their facility, in their organization. You may be talking to someone that just recently got promoted and now their job is going to be open. So network and talk when you get into these meetings. Don't just go into the meetings and attend to get the CEUs. That's great. Even if you are in schools, you probably can't get CEUs anyway. So your goal would be to go into networks to try to find out information on how to get a job, any job openings, any opportunities that's available, any places that other coders and other billers have worked for that they feel like it's a great for a new coder. We all were new coders at one point, so we all have some kind of recommendations or experiences that we can talk to newer coders or those that's in school about. So make sure that you do that as well. Last but not least, number 5, gain relevant experience. So I talk a lot about this on my channel, that in order for you to be marketable or to obtain a position in medical coding, once you are credentialed, you have to gain experience, preferably while you're in school. So if you are in school right now and you don't have a job, or you have a job but you are willing to get a new position and you're not in healthcare, first and foremost, try to get a job as a biller. Try to get a job somewhere in a revenue cycle, pre-authorization, medical records, scheduling, charge posting, anything like that. AR, try to get a job in the revenue cycle. That would be first and foremost. If you cannot get a position in the revenue cycle, then try to get a job anywhere in the healthcare system, anywhere in the clinic. I mentioned it probably in this video, but definitely on this channel before, that I knew a young lady that got into medical coding. She worked in the cafeteria. So she just was in the healthcare system. It was easier for her to transfer from the food services department into medical coding, because she already had a rapport with the hospital. They already knew her work ethic. She was already in the system. She networked with the providers. She networked with other medical coders and medical billers, people in the revenue cycle. So it was easier for her to transfer from one job to another, as opposed to just coming off the street, just being basically a nobody to the healthcare system or to that organization. Not saying that people that you could come off, you can't get a job coming off the street. I got my job. I didn't have a rapport with the hospital that I worked at when I first got into this field. I was fresh off the street, worked in a call center, but I believe my resume was really good. I took a lot of resume classes and business classes before I even applied for the job in the hospital. So I think that's why I was looked at. But do whatever you need to do to increase your chances in order to obtain a job in medical coding. Find a job in the revenue cycle, but the next best thing would be any job: housekeeping, cafeteria, food service, environmental services, the customer service call center, anything like that. Like anything that you could find a job in, the gift shop, anything that you are equipped to work, you have experience in, that will get you a foot in the door. Gain relevant experience in order to get a job as a medical coder so that you can obtain your first position. So that's it. I really didn't want this video to be 20 minutes, but I digress. Just to recap, while you're in school, this is the during phase. To increase your chances to get a job in medical coding, I would say network your butt off, craft a great resume, research current job openings in medical coding, attend your local chapter meetings for whatever organization you think you want to be a part of, whether or that you're studying through, a HEMA or AAPC. Go to any review classes that's being offered. Your meetings doesn't have to be local. There are a lot of, chapters that offer, those that are studying to become a medical coder. They allow you to attend those meetings. You may have to reach out to the president, to the chapter officers, but do whatever you have to do in order to see about attending those meetings. While you're a part of those meetings, during the networking time of those meetings, talk to other chapter members to see if they can give you a shoe-in on any jobs that may be available in their area or in their hospital, clinic, whatever. Last but not least, gain relevant experience, preferably in the revenue cycle management department. But if you can't find a job that you qualify for in the revenue cycle and you are looking to work in a big organization, a big healthcare system, take any job that's in the healthcare system and start networking while you're in that job. So I hope this helps. I hope you enjoy the first two videos of this series called Before, During, and After. What I would do if I had to start all over again and craft my career in medical coding and to try to make sure that I secure a job after I become credentialed. The next video will be after you become credentialed, what I would have done or what I suggest that you should do if you are newly credentialed and you haven't secured a job yet. We'll talk about that in the next video. So if you have any questions, leave them in the comments below. And until next time, I'll see you in the next video.